Hello everyone, welcome to the B.Pharm special program where we guide you to do better and smart studies. I am Swapnil Patil. I will shed light on one of the most interesting and vital topic of B.Pharm 4th semester, the important unit of compounding of medication 1, which is included in your subject pharmacy practice, which is dispensing and community pharmacies. Are you ready? Our topic is divided in a total 6 modules. Module number 1 is representing powder, module 2 tablet, module 3 capsule, module 4 tablet, trichurants, module 5 pills, module 6 lozenges. Now let's move to the first module, that is powder. Powders are solid dosage form medicament meant for the internal or external application. The powders meant for the internal use are known as oral powders, whereas those meant for the external use are known as dusting powders. Powders may be categorized as a simple or compound. When powders are dispensed in a large quantities in a container and the patient is asked to measure a specific quantity as the dose, then these powders are known as bulk powders. Bulk powders for the internal use, say for example compound sodium chloride and dextrose oral powder, compound rhubarb oral powder. For the bulk powder for the external use, for say example snuffs, talc dusting powder, tooth powder. Now friends, this is all about the powder. Let's move towards the module 2, tablets. Tablets are the unit solid dosage form having the shape flat or biconvex. Tablets are prepared by compression method and are hence called compressed tablets. Let's take advantages of tablets. Tablets are easy to administer. They are easy to dispense. These are more stable dosage form. They maintain the accuracy of dosage. For bitter and nauseous substances, which can be betterly given by tablet form by doing coating on them. Of all dosage forms, tablets are the easiest one and most economical when it comes to the packaging and transport. They are the lightest and most compact of all dosage forms. Each and every system has the disadvantage. Let's move towards the disadvantages of the tablets. Some drugs resist the compression into the tablet due to their amorphous nature or low density characters. Those are complicated for the tablet manufacturing. Second, for the bitter testing drugs, drugs with a objectionable odor or drugs that are sensitive to the oxygen or atmospheric moisture may require encapsulation or a special type of coating which may increase the cost of the finished tablet dosage form. Third disadvantage, drugs with a poor wetting, slow dissolution properties are difficult to convert into the tablet, which provide full drug bioavailability. These are all about the advantages, disadvantages. Let's move towards the types of tablets. Tablets are divided into the following types. Type A, tablets ingested orally, that is compressed tablets. For example, let's took paracetamol tablet. Second type, that is multiple compressed tablet. Third type, repeated action tablet. Fourth one, delayed release tablet. Let's example enteric coated bisacodyl tablet. Fifth example, sugar coated tablet. Example multivitamin tablet. Film coated tablet. Example metronidazole tablet. Chewable tablets. Those are like example antacid tablets. Second type of category is tablets used for the oral cavity, in which buccal tablet, example vitamin C tablet. Second type, that is sublingual tablet, example Vicks menthol type tablet. Troches and lozenges, these are the third category in which those are used for the oral cavity purpose. Tablets administered by the other routes, like example implantation tablet, vaginal tablet, example clotrimazole tablet. Next category of tablet is used to prepare solution, that is example one type effervescent tablet, in which Disprin or aspirin tablet is the example. Dispensing tablet, example enzyme tablet, digiplex. Third type, that is a hypodermic tablet. Fourth one is a tablet triturant, example enzyme tablet, digiplex. Now friends, you will notice that these are all types of tablets. Then what might be the formulation additives in that? Let's focus towards the formulation additives. Formulation additives in the tablets, in addition to the active ingredient, tablets contain the number of inert materials known as additives or excipients. Different excipients are diluent, binder and adhesive, disintegrant, lubricant and glidant, coloring agent, flavoring agent, sweetening agents. Let's look one by one what is the role of ingredient with the example. Like for example, first diluent. Diluents are the fillers used to make required bulk of the tablet when the drug dosage itself is inadequate to produce the bulk. For example, lactose anhydrous and spread-dried lactose. Second example is the directly compressed starch, star RX 1500. Hydrolyzed starches, for example, Ambedex, Cellutab. Microcrystalline cellulose, Avicel pH 101 or pH 102, dibasic calcium phosphate dehydrate, calcium sulfate dehydrate. All these are examples of diluent type category. Second is a binder or additive. In binder adhesives, these are the materials which are added either in a dry or in a wet form to form the granules or to form the cohesive compacts for directly compressible tablets. For example, acacia, tragacanth, solution for the 10 to 15% concentration. While cellulose derivatives like methyl cellulose, hydroxypropyl methyl cellulose, hydroxypropyl cellulose, gelatin 10 to 20% solution. Glucose in 50% solution, polyvinyl pyrrolidone in 2%, while starch paste in 10 to 20% solution. Sodium alginates, all those are binders. Third type of category is the disintegrants. Disintegrants added to the tablet formulation to facilitate its breaking or disintegration when it comes in contact with the water in GIT. For example, starch in 5 to 20% of the tablet weight, while starch derivatives, that is primogel, explotabs in 1 to 8%. Some clays are there like V-gum, bentonite in 10% level. Colored tablets only, that is cellulose, cellulose derivatives, agdisol, that is sodium carboxymethyl cellulose, super disintegrant, which are the different type of agents which are increases the disintegration by swelling up to the 10 to 20 folds. Those are releasing the drugs in 30 seconds when in contact with the water. For example, cross carbonyl sodium, cross-linked cellulose, cross-povidone, cross-linked povidone, cellulose, sodium starch, glycolate, cross-linked starch. Next additive, that is a lubricant and glidant. Lubricants are intended to prevent the adhesion of tablet material to the surface of dies and punches, which reduces interparticulate friction and may improve the rate of flow of the tablet granulation. Glidants are intended to promote the flow of granules or powder material by reducing the friction between the particles. For example, lubricants, stearic acid salt, stearic acid, magnesium stearate, talc, polyethylene glycols. Surfactants, glidants in which cornstarch in 5 to 10%, talc in 5%, silica derivatives, that is colloidal silicon dioxides, colloidal silicates such as carboxyl, siloid type, aerosyl, which is in a concentration of 0.25 to 3% concentration. Different additives also included like coloring agents. The use of colors, dyes in the tablets has the three purposes: masking of color, drugs, product identification, production of more elegant product. Example, food and drug cosmetic, FDC, tartrazine, FDC dyes, flavoring agent for the chewable tablets like flavor oil are used. Some sweetening agents are there for the chewable tablets like sweetening agents sugar, mannitol, saccharin, which is an artificial one, which is 500 times sweeter than the sucrose. But instead of having some advantages, it's have the disadvantage. Main, that is a bitter after the taste and carcinogenic. especially for the aspartame, which is an artificial sweetening agent. What are the tablet operations involved in the tablet manufacturing? First is the direct compression, in which some processing steps, as if in sequence. Sequence is like that: raw material, which is proceeded for the weighing, which is then afterwards weighing is proceeding to the screening, then for the mixing, and then finally compression. In second step, that is a type of one of the type of method which is used for the manufacturing of tablet, that is a dry granulation. The processing steps involved in dry granulation: raw material selection, weighing, then afterwards screening, then screening leads to the mixings, then involves two types of methods further, that is a slugging, which followed by the milling, then afterwards screening, and again mixing to finally lead to the compression. While in a wet granulation, some processing steps are like raw material to the weighing, which is leading to the screening, then afterwards wet massing, followed by sieving and milling and drying, that is a major step. And after the drying, whatever the granules, those get screened, mixes, and to produce for the blend for the direct compression or compression. This is all about the tablet manufacturing, additives, manufacturing methods. Now let's move towards the module 3, which is capsule. Capsules are the unit solid dosage form in which the drug substance is enclosed in water soluble shell or envelope. A capsule shell is made up from gelatin, is the major constituent. The capsules are available both as a hard gelatin capsule and soft gelatin capsule. What are the advantages of capsules? Let's deal one by one. One, that is drugs having the unpleasant odor and taste can be administered by enclosing them in tasteless shell. Second advantage, they are smooth, become a very slippery when moist and can be easily swallowed. Third advantage, they are economical. Fourth, they are easy to handle and carry. Fifth, the capsules release the medicaments as and when desired in gastrointestinal tract. Sixth advantage, capsules are made from the gelatin and hence they are therapeutically inert. Seventh one, that is they are attractive in appearance, while eighth, that is microencapsulation, results in sustained release dosage form. Let's move towards the disadvantages of capsules. One, that is the hygroscopic drugs cannot be filled in capsules. They absorb the water present in the capsule shell and hence make it very brittle, which ultimately breaks into the pieces. Second disadvantage, the concentrated preservatives which are needed. Previous dilution are unsuitable for the capsules because it may lead to the irritation in stomach if administered as such. Types of capsules: hard gelatin capsules, which are typically made up of using the gelatin and containing dry powdered ingredients, or miniature pellets made by example processes of extrusion and speronization. These are made in two halves, that is lower diameter, which is known as body, that is filled and then sealed using the higher diameter, that is cap. While soft gelatin capsules, soft shelled capsules primarily used for the oils and for the active ingredients that are dissolved or suspended in the oil. Let's move towards the module 4, that is the tablet tratulents. These are the small tablets, usually cylindrical, molded or compressed, and contain the patent medicament with a diluents. On a small scale, tablet tratulents are prepared by using the hand-operated tablet tratulate molds, but for the bulk production, automatic tablet tratulate machines are used. A combination of sucrose and lactose is usually used as an diluent. They are prepared mainly by the compression rather than the molding. The tablet tratulents must be readily and completely soluble in water. Thus, any water insoluble material is avoided in the formulation. In the preparation of this tablet compression, only the minimum amount of pressure is applied. Tablet triturates are used for the oral administration or sublingual purpose. Example, nitroglycerin tablets. They may also be used in compounding procedures by pharmacists in the preparation of other solid or liquid dosage forms. They can be inserted into the capsules, and this eliminates the problems of measuring the accurate amount of potent drugs in the powder form. They can also be dissolved in the small amount of water which can be subsequently mixed with the required one. Now friends, we will move towards the module 5, pills. A pill was originally defined as a small round solid pharmaceutical oral dosage form of medication that was in use before the advent of tablet and capsules. Pills were made by mixing the active ingredients with an excipient such as glucose syrup in mortar and pestle to form a paste, then rolling the mass into the long cylindrical shape called as a pipe and dividing it into the equal portions which were then rolled into the balls and often coated with the sugar to make them more palatable. Let's move towards the module 6, that is lozenges. Lozenges are unit solid dosage form. These are the solid preparations that are intended to dissolve or disintegrate slowly in the mouth. They contain one or more medicament, usually in a flavored sweetened base. Lozenges are most often used for the localized effects in the mouth. They can also be used for the systemic effect if the drug is well absorbed through the buccal lining or is swallowed. More traditional drugs used in this dosage form includes phenol, sodium phenolate, benzocaine, cetylpyridinium chloride. Newer drugs include the analgesic, anesthetics, antiseptics, antimicrobials, antitussives, antinosants, and decongestants. Lozenges have the advantage of being easy to administer to the pediatric one and geriatric one, having the formulate that are easy to change and can be patient specific, keeping the drug in the contact with the oral cavity for the extended period of time. One of the disadvantages of using a gummy type lozenges with the children is they may perceive it as a candy and not a serious dosage form. Lozenges can be made by molding or by compression, and the name trouch is applied to the compressed lozenges, but in the layman's language, lozenges and trouch are used interchangeably. Commercially, lozenges are made by the compressions. They are harder than the ordinary tablets, so they will slowly dissolve or disintegrate. Compounded lozenges can be prepared by molding the mixture of ingredients containing sugars to form a hard lozenges, polyethylene glycol to form a soft lozenges, gelatin to form a chewable lozenges. Conclusion: with all the information here, we come to the end of this topic, in which we discuss the dispensing and compounding aspects of dosage forms in specific modules like powders, module for tablet, module for capsule, module for tablet triturants, module for pills, and 6th module that is for the lozenges. Module 1, that is ointment, module 2 cream, module 3 paste, module 4 jellies, module 5 suppositories. Let's do one by one. Module 1, ointment. These are the semi-solid preparation of drugs either dispersed or dissolved in suitable base meant for application to the skin or mucous membranes. Advantages: handling of ointments is easier than the bulky liquid dosage form. They are chemically more stable than the liquid dosage form. Another advantage of ointment, they facilitates the application of the directly to the affected body part and avoid the exposure of other parts to the drugs. They are suitable for the patients who finds it difficult to take the drugs by parenteral or oral route. They prolong the contact time between the drug and affected area. The bioavailability of the drug administered as an ointment is more since it prevents the passage through the liver. Let's look towards the disadvantages. They are bulkier than the solid dosage form. When the application of an exact quantity of the ointment to the affected area is required, it is difficult to ascertain the same. They are less stable than the solid dosage form. The various types of ointments are medicated ointment, unmedicated ointment. Classification of ointment bases. This is an important part in which four different classes of bases are available. Hydrocarbon base or oleaginous bases, it known as adsorbent base, emulsion base, water soluble base. Let's look one by one. Hydrocarbon bases. These are the semi-solid hydrocarbons obtained from the petroleum. Example: hard paraffin, yellow soft paraffin, white petroleum, and geled oleaginous vehicle. Absorbent bases. These are the hydrophilic mixtures of hydrocarbons and the substances with the polar groups. Substances like cholesterol, lanolin, lanosterol may be used in the formulation of absorption bases. Example: hydrophilic petrol atom, hydrous wool fat, and oily cream. Emulsion bases. These are the miscible with water and contain oil in water emulsions. They can be easily removed from the skin. They contain the surfactant which serve the purpose of emulgent. Based on the nature of surfactant presents, emulsion bases are of three types. Anionic emulsion bases contains the anionic surfactant like sodium lauryl sulfate. Example: hydrophilic ointment and emulsifying ointment. Cationic emulsion bases contains the cationic surfactant like cetrimide. Example: cetrimide emulsifying ointment. While third category, that is non-ionic emulsion bases, contains the non-ionic surfactant like cetomegrogol. Example: cetomegrogol emulsifying agent or wax. Water soluble bases, they do not contain the oily ingredients and are called as greaseless bases. They are completely soluble in water. Example: polyethylene glycols, poloxol 40, polysorbates, module 2, that is cream. Cream is a typical preparation usually for the application to the skin. Creams may be considered as a pharmaceutical product, as even cosmetic creams involved in pharmaceutical techniques for their manufacturing, and medicated creams are often used in a variety of skin conditions. Dermatosis. The use of the fingertip unit concept may be helpful in guiding how much topical cream is required to cover different areas. Creams are semi-solid emulsions of oil and water. They are divided in two types: oil in water creams, which are composed of small droplets of oil dispersed in continuous phase, and water in oil emulsion creams, which are composed of small droplets of water dispersed in continuous oily phase. Oil in water creams are more comfortable and cosmetically acceptable as they are less greasy and more easily wash up using the water. While water in oil creams are more difficult to handle, but many drugs which are incorporated into the creams are hydrophobic and will be released more readily from the water in oil cream than oil in water cream. Water in oil creams are also more moisturizing as they provide an oily barrier which reduces the water loss from the stratum corneum and the outermost layer of skin. Usually, what are the uses of the creams? The provision of a barrier to protect the skin. This may be a physical barrier or chemical barrier, as in case of sunscreens. Another advantage to aid in retention of moisture, especially water in oil creams. Its main purpose is for the cleansing, emollient effect, as a vehicle for the drug substance such as local anesthetic, anti-inflammatories, NSAIDs or corticosteroids, hormones, use of antibiotics, antifungals or counter irritants through the skins. Creams are semi-solid dosage form containing one or more drug substance dissolved or dispersed in suitable base, and this term has traditionally been applied to the semi-solid that possesses a relative fluid consistency formulated as either water in oil or oil in water creams. However, more recently the term has been restricted to the products consisting of oil in water emulsions or aqueous microcrystalline dispersions of long chain fatty acids or alcohols that are water washable and more cosmetically and aesthetically acceptable. Creams can be used for administering drugs via vaginal route. Example: triple sulfa vaginal creams. Creams are used to help in sunburns compositions. There are four main ingredients of the cold creams. First is water, second is oil, third is emulsifier agent, and fourth is thickening agent. What are the advantages associated with the creams? All we already studied. Yes, easily washed away with water, easy wipe off, less greasy compared to the ointment, easy to spread on the skin surface, example easy to apply, suitable for the sensitive, dry and fair skin, suitable for the acute lesions. What are the disadvantages? The disadvantages is stability is not as good as ointment. Now friends, let's move towards the third module, that is pest. These are semi-solid preparations containing one or more drug substance for the topical applications. Advantages of paste are mixture of powders and ointment, contains a high proportion of finely powdered solids such as starch, zinc oxide, calcium carbonate and talc. What are the disadvantages associated with the paste? Less occlusive than the ointment, can be benefited depending on the indication. This is all about pest. Let's move towards the module 4, that is jellies. Jellies are the transparent and translucent, non-greasy, semi-solid preparations mainly used for the external applications to the skins. Example, synthetic and vegetable gum jellies. What are the characteristics associated with the jellies? These are the transparent preparations containing cellulose, ethers or carbomers in the water or water alcohol mixture. Based on the aqueous polyethylene glycol miscible with the water, gels liquefy on contact with the skin, dry and leave a thin film of active medication. Let's move towards the advantages of jellies. Much less greasy as compared to the ointment, give cooling sensation suitable for oily or dark skin. Disadvantages of jellies are the sticky one. Module 5, that is suppositories. A suppository is a drug delivery system that is inserted into the rectum, rectal suppository, into the vagina, that is vaginal suppository, while into the urethra, that is urethral suppository, where it dissolves or melts and it absorbs into the bloodstream. They are used to deliver both systematically and locally acting medications. Examples, Dulcolax, that is bisacodyl suppositories, Anusol SC and hemorrhoidal SC, hydrocortisone acetate suppositories. Characteristics of the suppositories: solid dosage form that is inserted into an orifice in the body where they soften, melt and then dissolve. Advantages of suppositories: rectal suppository can provide the local and also systemic effects. They came in different sizes for the adults and children. Suitable when administration via the oral route is difficult. Example, nausea, intolerance, vomiting or gastric pain, or when patients are uncooperative or have low consciousness. Also suitable when the IV route is difficult. These are having the rapid action, no first pass metabolism in this. Disadvantages of suppositories: uncertain absorption, local irritations. All this is about the module 6. Now friends, conclusion. With all these informations, here we came to the end of the topic. We discuss dispensing and compounding of dosage form, in which ointments, creams, paste, jellies, suppositories, we discuss all in details. I will back with one of more interesting lecture in the same series of pharmacy practice, dispensing and community pharmacy. Till then, keep studying. Goodbye.